Hi everybody, my name is Emily and I just completed a shift of clinical hours for this term. I'm going to go ahead and get started on this first assignment, which is a report that I gave to my preceptor on a patient that we saw today. To get started, our patient is a 28-year-old female presenting to the urgent care with a chief complaint of a sore throat. She describes the sore throat as swallowing glass, and it's preventing her from eating and drinking over these last couple days. She stated that the sore throat started about 4 days ago and that she works in a daycare where a lot of the children have been testing positive for strep throat. She does strongly believe that it could be strep, but she's unsure at this time. Her vitals are as followed: a temperature of 99.4 orally, a blood pressure of 110/74, a heart rate of 88, respirations 14, SpO2 of 99%, and she rates the pain an 8 out of 10 on a scale of 1 to 10. She has no known allergies. She has no past medical history, no past surgical history, and she is not currently taking any medications at this time. Upon examination of the back of her throat, it is reddened. She has exudate covering both tonsils. Tonsils are swollen, about 1+ bilaterally, and it is noted that there is halitosis upon the examination. The rest of her physical examination is unremarkable at this time. Strep throat is suspected, but I would recommend doing a rapid strep test, which is a throat swab that takes about 15 minutes to complete. If the result yields a positive result, I would go ahead and treat this patient with amoxicillin, 500 milligrams tablets to be taken by mouth every 12 hours for 10 days. If the rapid strep comes back negative, I would recommend testing the patient for COVID and the flu. We have a combination swab. Rapid test takes about 15 minutes to do next. If that comes back negative, I would follow up with a respiratory PCR culture, which takes a couple days to come back. It's a more invasive test that covers multiple different bacterias and viruses. It's another throat swab, but it's more accurate to go from there. And that would be my recommendation for the patient.